The COVID vaccine is finally here, and efforts are being made to roll it out across the country.
I did it! I'm so happy.
For millions, it's a path to getting their lives back, especially for the elderly tucked away in nursing homes.
It's like life little hurdles, Until I get the shot, I'm staying in this room.
But what does the rollout look like in one of the most anti-vax places in the country? AJ Plus obtained exclusive footage of a lawmaker speaking with anti-vax supporters against the COVID vaccine.
And I have to have energy to stop this vaccine shit that's coming.
For those trying to fight back, it's been an uphill battle.
Just absolutely crushed anybody's dreams of speaking to power in this building.
We're in Ohio to find out how much influence anti-vaxxers are exerting on state policy and what happens when they forge alliances with the people in power.
So the interview's over.
Does Health Freedom Ohio represent the beliefs of the majority of Americans?
It's the second day of vaccinations in Ohio, where COVID has become the third leading cause of death.
All right, you ready?
I'm ready.
Frontline healthcare workers like Virginia Castle expressed hope that the end of the pandemic in the U.S. is on the horizon.
It was my goal to survive this beast, to get to this point. And now my next goal is to be able to take the masks off and hug my family.
For some Americans, though, respite from the virus is still months away, and a dangerous battle over who's willing to take the vaccine is playing out. Consider this, more than half of Ohio's nursing home staff have refused it, according to the governor.
Hello.
Hey, Bruce, it's Angie. How's it going?
Angie.
Bruce McGillis lives in a nursing home just outside Cleveland in Northeast Ohio. No visitors have been allowed inside since March, so Bruce spoke with us through the window of his room.
Well, everybody in here is in a dark room. No sunlight, no fresh air.
Would you take the vaccine today if you could?
Yeah, I'd take it in a heartbeat. I have no other shot. I have to trust that if Dr. Fauci says it's good, I'm taking it,
108 patients have tested positive for COVID at the facility this past year. It's one reason Bruce won't leave his room for anything.
It's like life little hurdles, Until I get the shot, I'm staying in this room. Until I get the second shot, because you got to get 2 shots. I'm staying in this room.
The virus has ravaged nursing homes, accounting for almost half of all Ohio deaths from COVID-19. It's something Bruce is acutely aware of.
Would you want to have to go to someone's funeral because you didn't take the shot? You have to look beyond yourself sometimes. You got to help the other people. You know what I'm saying?
A spokesperson for the nursing home couldn't tell us how many staff refused to take the vaccine. Ohio's anti-vaxxers have been preparing for this exact moment. They're an organized and strategic minority that's managed to build connections with lawmakers in the state. In April, the chair of the House Health Committee, Representative Scott Lips, had a call with members of Health Freedom Ohio, an anti-vax lobby group, where he said this.
So I need help with the members of the health committee because we're going to face a couple huge bills that are going to matter. You're going to face a couple bills that this group does not like, and I have to have energy to stop this vaccine shit that's coming.
During the call, he also bragged about working with the group's president, Michelle Cotterman, on legislation that would give workplace employees the right to say no to the flu vaccine.
So I hope you guys understand that, he is a representative who is willing to go to bat for us on this issue, and he's not afraid of taking on these, experts and medical professionals, if you will, on behalf of what is right.
Someone was feeding me information, and I was using that information. So they weaponized me and educated me. It was fun, actually, to have the truth.
We went to the Ohio Statehouse to ask him more about that April call.
Yes.
Well, you did have a call with anti-vaxxers where you said we need to stop this vaccine shit that's coming. What did you mean by that?
I meant that. I meant until we have the proper studies and understand what we're putting in our body, we've got to slow it down. I don't know that stop it, that's a strong term, and I did use that term, but I think slow it down is a better term And it's funny, you picked up that one call, but what about the other 450 calls or Zooms I did this year? Do you want to talk about those too?
Well,
or do you want to talk about your personal agenda?
the story that we're reporting on is the vaccine.
So you're slanting the story to get what you want, so the interview's over. Thank you.
Does Health Freedom Ohio represent the beliefs of the majority of Americans? Sir, you're the chair of the health committee. What are you doing to keep Ohio safe?
It's not just representative lips. Multiple Ohio state lawmakers have been explicitly endorsed by or sided with anti-vaxxers. State Representative Nino Vitale, who in July told his constituents not to get tested for the coronavirus, has openly expressed anti-vaccine views. Here he is sharing unfounded conspiracy theories to another anti-vax group, Ohio Advocates for Medical Freedom.
Bill Gates spends a fortune of his money on coming up with a solution to a medical health crisis that I question whether he creates or not, or is in on it. I don't know. I hope no one's that evil. But to that I would say no thanks, Billy. Okay, no thanks. Everybody should have the choice again to decide. But to force everyone to be vaccinated is offensive to freedom to me. It's completely offensive to freedom.
To be clear, the government isn't forcing anyone to take the COVID vaccine. And in Ohio, you can refuse a vaccine for religious, medical, or philosophical reasons. We reached out to Representative Vitale, who said he objected to the term anti-vaccination and said he believes in medical freedom. But that language is a tactic straight out of the anti-vax playbook, says activist Sarah Berry.
The anti-vaccine movement has, over the years, used the term medical freedom as a camouflage against their anti-vax beliefs. They don't want anybody associating the term anti-vaxxer with them. They disown that term. It's a phrase that appeals to a lot of conservative lawmakers' sense of, personal freedom and individual liberty.
Anti-vaxxers are opposed to vaccination for a variety of medical and ideological reasons. They often draw a fabricated link between vaccines and autism. But the CDC is very clear on this. Vaccines have been proven to work and do not cause autism. Back at the hospital, Virginia told us if enough people aren't willing to take the vaccine, we won't be able to create public immunity.
I would absolutely urge everybody to get vaccinated. The sooner we can get the adequate number of people vaccinated, the sooner normal life can come back.
For health workers like Virginia, the movement against vaccination is a personal blow.
It hurts. It hurts my heart that people think it's no big deal, that we who are facing the worst of what COVID has to offer cannot convince them the truth, that they think we are lying.
That's one reason Sarah is on a mission to bring attention to the outsized role anti-vaxxers play in Ohio politics.
The anti-vax movement is more powerful than it's ever been. And I think a lot of people aren't paying attention to it, which is problem number one. If you're not paying attention to it, you're never going to be able to solve it or engage with it in an intelligent way. And they're so powerful, they're winning.
Ohio came very close to passing a bill heavily supported by anti-vaxxers. Senate Bill 311 would have crippled the health department's ability to pass and enforce public health measures. Sarah wanted to testify against it back in June and call out the role of anti-vaxxers in supporting it. But Sarah says she was tricked into withholding her testimony by then Senator Dave Burke.
When I tried to testify that day, he said to me, oh, well, we're actually going to introduce a substitute bill. Instead of testifying now, why don't you wait until we voted to substitute the bill, and then you can come back and vote on it.
AJ Plus obtained exclusive video of Health Freedom Ohio's lobbyist admitting they contacted Mr. Burke in an attempt to block Sarah's testimony that day.
He masterfully worked it so that she really couldn't give her testimony. And then he said, that concludes the hearing on the bill, drop the gavel, and the committee's over with, and we're all taking off to go to session. So we kind of worked behind the scenes to make sure that didn't see the light of day.
They have enough power that they've been able to hire a lobbyist, and that lobbyist was influential enough that he was able to make efforts to block my testimony from being heard in committee. In what way is that not anti-vaxxers winning? They get to silence their opponents and have all the political power.
We were interviewing Sarah at the Ohio Statehouse when she ran into Senator Burke.
I have
So
I know what you're talking about.
Sir?
I've got to go to...
Sarah confronted him about misleading her into not testifying.
I'm
having a hard time believing that, sir.
Well, I don't know anything about what you're speaking to. Nobody stops anyone from testifying.
Why would a lobbyist brag about it then?
I have no idea. You have to talk to him. I've never heard of this.
I just have a hard time believing that, sir. I'm very disappointed in you. I'm very disappointed in you.
I have no idea what you're talking about.
I'm the citizen, so I'm allowed to be disappointed in you, and you've just absolutely crushed anybody's dreams of speaking to power in this building.
We reached out to Mr. Burke and Health Freedom Ohio for comment. They did not respond to our request. One thing is clear, the lobbying efforts of anti-vaxxers in Ohio are persistent and visible.
The fact that they didn't want me to speak made me feel like, okay, well, that's how scared they are of me. It means that I absolutely should be down there saying what I have to say and speaking truth to power and making sure none of them stop me, because no one else is gonna do it.
Sarah says that in order to combat their influence, people need to become actively pro-vaccine.
If people are like me and they believe that vaccines are safe and effective and that they don't cause autism, they should start lobbying their legislators. Now we all have to go down and do something about it and start telling them, no, I want the vaccine. I don't want someone at a nursing home to be able to refuse this vaccine because of the safety of my loved one.
Hi, Bruce.
Howdy, howdy. Wow.
In mid-January, Bruce received his second dose of the vaccine shot, and his excitement was palpable.
Right arm, Bruce?
Right arm.
How does it feel, Bruce?
Free at last, free at last. Thank God, free at last.
But for now, he has one message for the rest of the country.
America, somehow we have to find a way to get back together again. You have to be hopeful. You have to look at the positive, try not to focus on negative and how far you have to go.